Hi, my name is Jessica. I am one of the associate providers on the colorectal surgery team here at Dartmouth-Hitchcock Medical Center. In this video, I will review part 2 of this 5-part ileostomy education review. In this section, we will focus on what to expect in the hospital.
Let's start with the day before your surgery. You will receive a phone call from one of our nursing staff between 1 p.m. and 7 p.m. Make note of the time because if it's 5 p.m. and you still haven't heard from your nursing staff yet, don't worry, you will. You might also want to consider staying local. Depending on weather conditions and your distance from Dartmouth, you may want to consider staying locally the night before your surgery, especially if you're listed as first case of the day. We do have resources available, so feel free to give our clinic a call if you'd like more information. Most likely, you will need to complete a bowel prep the day before surgery. This is essentially following a clear liquid diet, taking Miralax to empty your bowels, and following a regimen to stay hydrated. Now, what to expect in the hospital. Our colorectal surgery team likes to follow something called Erath, which stands for Enhanced Recovery After Surgery. The basis of this protocol is to minimize your hospital stay by optimizing your recovery. This includes minimizing narcotic pain medication, early ambulation, and early diet. You should anticipate a 3 to 7 day hospital course. Your hospital course could be longer than 7 days, but it won't be shorter than 3 days. And the ostomy nursing team. They are here Monday through Friday only. If you are nearly ready for discharge over a weekend, but haven't yet had sufficient teaching with the ostomy nurse, we will keep you till Monday for another teaching session before discharge. Day of surgery, your operation. Your surgeon has discussed with you whether they plan to proceed with open versus laparoscopic or robotic assisted surgery. Open surgery, as demonstrated on the 2 photos on the left, includes one long incision, either a vertical incision down the middle or a horizontal incision across your pelvis. Your incision will either be closed with dissolvable sutures or with staples. Staples can often be removed in 2 weeks. For laparoscopic or robotic assisted surgery, you will have 5 to 6 1-inch incisions and one slightly longer incision where the specimen is removed. These will all be sutured closed and often glued with Dermabond on top. This glue will gradually wear away over 1 to 2 weeks. The last photo includes a surgical drain, as shown by the tube coming out of the patient's belly. You may have a surgical drain in place after your surgery, and this is almost always removed prior to your discharge. I also want to mention that occasionally we will use an incisional vac. This is a special dressing that helps prevent infection and is always removed prior to your discharge. Now, day of surgery after your operation. After your operation, you will be brought to the PACU, or the post-anesthesia care unit, where you will wake up from surgery before transferring to the general surgery floor. You will have a urinary catheter in place to drain your bladder, and we will work on achieving good pain control. Also, you will most likely be permitted a clear liquid diet. And if you were in the PACU long enough awaiting transfer to the floor, we would love for you to be up and walking. Post-op day 1 and 2 after surgery, we want you up and walking 4 to 6 times every day. We want you tracking your intake and output, which means tracking how much you're drinking, how much urine you're making, and how much is coming out of your ileostomy. You'll also start to work with the ostomy nurses to gain more education and instruction. We'll have you emptying your ostomy pouch, and by post-op day 2, changing your pouch. You'll remain on a clear liquid diet until your ostomy is putting out poop. A tip is to avoid carbonated beverages until you are having gas output from your ileostomy. And often your urinary catheter is removed on post-op day 1. However, depending on the full extent of your surgery, your urinary catheter may be removed at a later point. Once removed, most patients are able to pee on their own. However, if you are unable to pee after the catheter is removed, we will reinsert a catheter to drain your bladder and often provide 1 to 2 more attempts to pee. If you are still unable to pee and you are meeting criteria to discharge otherwise, we will discharge you with a catheter in place and have you follow up in 7 to 10 days for another voiding trial. Post-op day 3 and beyond, we still want you up and walking 4 to 6 times every day. We still want you tracking your intake and output, and you'll continue to work with the ostomy nurse for education and instruction. You'll continue to empty your pouch and participate in pouch changes. And as soon as you're demonstrating a productive stoma with poop, we'll advance you to a modified low-fiber diet. Poop often appears green, brown, or yellow in color and starts off liquidy and eventually becomes thicker in nature. Worth mentioning, the first liquid you see in your ileostomy pouch resembles red Kool-Aid, and we refer to this as bowel sweat. This does not count as return of bowel function, so unfortunately, no points for this. You may not have an appetite after surgery, and this may persist for days or weeks. However, as long as you're not nauseated, vomiting, bloated, or having excessive burping, reflux, or hiccups, you should be encouraged to continue eating small portions slowly all throughout the day. Activity after surgery. Walking. You'll hear me say this time and time again. You should get up and walk every day, including same day as surgery. We encourage you to get up and walk 4 to 6 times every day. You should spend more of your day out of bed than in bed. Showering. Most of our patients can shower anytime after post-op day number 2. Hospital staff will be available to assist you with this process. We highly encourage you to continue to perform self-care tasks such as brushing your teeth and your hair to aid in your healing process. Incentive spirometer. This is the device pictured on the slide. This helps expand your lungs to prevent an infection. It's a breathing aid. You should use it every 10 to 15 minutes while awake and in your room. Activity restrictions. After surgery, you are not permitted to strain, push, pull, or lift greater than 10 pounds for 6 weeks. Additionally, no running or jumping for 6 weeks. You may walk, ride a stationary bicycle, or gently move on an elliptical. You can also do desk work. For time off work, we can write a work note for 6 weeks off work from date of surgery. If you would like to go back sooner, you may return sooner with light-duty work restrictions. Feel free to ask your team for a work note on day of discharge for the most up-to-date plan. Sleep and pain control. Unfortunately, a hospital is not the best place for a restful night's sleep. Nurses, doctors, and associate providers such as myself, and ancillary staff, case managers, physical therapists, and occupational therapists come in to check on you regularly. Nurses have scheduled times that they must check your vital signs and administer medications as well. Try to spend most of the day up and about so that you can optimize nighttime hours for sleep. Private room versus semi-private. We do our best to accommodate all of our patients and if possible, have them recover in private rooms. Unfortunately, this is not always possible, and sometimes you will be assigned a room that you share with another patient. This is not determined until after your surgery when you are recovering in the PACU. For pain control, we have a lot of different tools and therapies to manage pain, and some discomfort should be expected. It's our goal for you to be comfortable enough to walk around and limit use of narcotics postoperatively. Goals to discharge include a functioning ileostomy. Your ileostomy needs to be producing gas and poop, making adequate urine, whether you have a catheter in place or you're peeing normally. You need to be able to tolerate a diet, taking in enough calories to meet your daily needs, and you need to be able to stay hydrated, whether this is drinking fluids or with IV fluid hydration. And you should be comfortable. Your pain should be controlled well enough to walk and move around safely, and you should also be comfortable emptying your ileostomy pouch and have participated in at least one pouch change. Now it's time to leave the hospital. If you go home, VNA services will be set up for you. This means a visiting nurse will come to your house and check on you after your discharge. If needed, we can also set up other home services including physical therapy, occupational therapy, and social work. Alternatively, rehab is another option. This is a joint decision made between you, your family, and us. Our case managers will work closely with you and your family to find the best facility for you. Medications after surgery. If you are on any delayed release medications, these should be changed to immediate release options to optimize your absorption now that your colon isn't connected. You will need to follow up with your original prescriber for ongoing refills of these medications. I also want to mention Lovenox. This is a medication that helps prevent life-threatening blood clots. If you have Crohn's disease, ulcerative colitis, or if you are having surgery to remove a cancer, you will need to remain on Lovenox for a total of 28 days from date of surgery. This is an injection with a needle. You will be taught how to self-administer prior to discharge. If you are already on a blood thinner, such as Coumadin, Eliquis, or Xarelto, instructions for using that medication will be discussed individually at time of discharge. Finally, driving. You can drive once you are off of narcotic pain medication for at least 8 hours, and you feel comfortable and safe to drive. If you needed to make a quick turn, you would be able to do so. After discharge, call us anytime. We are here to support your recovery even after you discharge from the hospital. 365 days a year, 24 hours a day. You can always give us a call to get your questions answered and get troubleshooting advice. These phone numbers will be provided on your discharge instructions. Thank you for watching. Please enjoy our other videos to complete this 5-part ileostomy education review.